Uh, Thank you, everyone, for joining our Peppy session today. Today, we will have the second of a three-part series by Jacob Blachowicz. Jacob is a PhD student in the Virginia Tech Translational Medicine, Biology, and Health program. And this three-part series is focused on rural health and disparities in rural health. And we're progressing from general knowledge about patients and rural health care, which was given on the 3rd of September. Beautiful talk by Jacob. You can find that on our YouTube site, which will be put as a link into the chat. Today, Jacob will talk about giving an overview of rural health disparities among patients with allergic and immunologic disease. And then on October 8th, as you see, he'll conclude his series focused on patients with primary immune disorders living in rural America. I'm Nick Ryder, one of the members of PEPI. I, along with Angie Tyree, who's here, Dr. Larry Borish, who I think will be joining us, Dr. Monica Lawrence, and Jacob are the members of PEPI, Project ECHO for Primary Immune Disorders. We're very grateful to have you here. Please, as you see in the chat, put your name, your affiliation, and maybe even what you hope to learn through your time at PEPI. We cherish your engagement, your involvement, and you can also see the QR code that we have a website. Feel free to interact with us there. And again, great to be with you all. Thank you. And with that, I will turn it over to Jacob. Jacob, take it away. Thank you.
All right. Thank you for the introduction, Dr. Ryder. Let me just switch my screen over to my presentation here. So, like Dr. Ryder said, today I will be talking about rural health disparities among patients with allergic and immunologic disease. This will not be quite as general as it was last time, but I will still go over, generally what is rural to start, just in case anyone missed my last presentation. So urban counties or metropolitan counties are core counties with one or more large urban areas, and these also include the surrounding areas with about 25% or more of individuals who commute there. Micropolitan, or your larger rural areas, are your non-metropolitan counties with an urban area that has over 10,000 individuals, but they're either not as large as the metropolitan areas or there aren't as many urban areas. Once again, these include your nearby counties with over 25% commuters. And non-core are your very rural areas that either don't have an urban area at all or just have a very small one that doesn't meet the other specifications. You can see on the map on the right from the Rural Health Information Hub that the majority of the United States is considered rural. Those dark blue areas across the US, there's about 97% of the US land mass is made up of those rural areas, and that includes about 20% of the US population. So just to start out, we'll look at asthma. The prevalence here stratified by demographics from 2016 to 2018. You can see that it's more prevalent in women, those in their teenage years generally, individuals of multiple races, as well as the Black and AIAN population. And as for Hispanic races, you can see it's more common in Puerto Rican races. It's also more common in those below the federal poverty line. And generally, overall, the asthma prevalence in the US is about 8%. And this is that same percentage, but stratified by metropolitan statistical area. So the bottom right, or their non-metropolitan area down there, is where our rural area is versus the others. You can see generally the rural areas are a little bit higher across the board and have a gradually increasing slope overall. So it's gradually increasing in prevalence within rural spaces, whereas looking at the urban graphs, it's actually going down a little bit. This is mortality rate, similarly stratified by the rural versus urban areas. You can see in the bottom right, rural, once again, is a lot up and down. It's not quite as smooth as we see in the urban ones, which are kind of just generally going down. You can also see that overall, the rural prevalence of asthma is generally higher than in urban areas as well. You can see the urban ranging from 10 to 11%. Whereas the rural ranged from 14 to 12%-ish, where it was a few years ago. And this is the demographics of that mortality rate. Once again, you see it's higher in women and in the Black population especially for the mortality rate. Something to consider if you saw my last presentation, the bottom right corner of the United States, essentially down in the southeast, is very heavy in the Black population. It's got a lot of areas that are over 20% Black, and that's a lot of where your rural health disparities tend to come from, racial wise, at least in that area. Additionally, you can see that individuals over 65 are primarily where that mortality from asthma is coming from. And it's important to be aware as well that generally there is a higher proportion of aging and older individuals in rural areas as well. So something to consider there. Then this is just kind of that chart of the mortality rate, but in an easier to see way where it's split up among each category of rurality. You can see that it is substantially higher in the non-core or your very rural counties, with it a little bit higher than your largest metropolitan urban areas in the larger rural areas as well. Moving from there, we'll talk about allergies. So allergic rhinitis, atopic dermatitis or eczema, and food allergies. Starting with allergic rhinitis, this was a systematic review study conducted relatively recently, looking at rural versus urban allergic rhinitis risk. You can see there aren't a lot of studies that have looked at it, so certainly an area that we need to look at more. But findings have been kind of inconsistent on whether it is more prevalent in rural areas or less prevalent, though the most recent study from 2020 did find that it was about 2 times as likely in rural areas, which could make sense considering the increasing prevalence of asthma and other allergic diseases noted in these spaces. And here are some risk factors or protective factors for food allergies, one of which is the rural environment is often associated with protection for allergic diseases in general, especially for food allergies. Breastfeeding is considered protective, as well as the introduction of solids into the diet. And eczema, or the atopic dermatitis, like we mentioned, is considered to be an important risk factor for food allergies as well. There's some evidence that formula, probiotics, and vitamin D can potentially make a difference, but that's inconsistent across the board, so we don't know for sure. And it doesn't seem like any changes in maternal diet really make a difference in the allergic outcomes of the patient. But what we're really going to focus on here is the fact that rural environments are often considered to be protective. Dr. Borish mentioned in his talk about a month ago the kind of microbiota hypothesis that leads to a lot of these allergic diseases, specifically that rural and farming environments are considered very protective for that. So places with lots of farm animals or lots of pets, where you consume raw milk, you have a greater exposure to microbiota and just environment in general, which potentially leads to increased immunity and decreased risk for that. It's also important to note that air pollution, while generally thought of to be greater in urban areas, is also prevalent in rural areas as well. It's just a different type of exposure. You're seeing a high prevalence of smoking in those areas, as well as, coal and wood smoke and things that you don't generally see in urban areas. Additionally, greenness, just general prevalence of the environment through vegetation and pollen and all those things as well contribute. So specifically for farms being protective, it's important to realize that the total amount of farms that we have in the United States and how much land they take up is drastically decreasing. Over the past about 20 years, you can see that it's gone down about 70 million acres, which is very substantial and obviously something we need to look at. Additionally, the size of the individual farms is substantially increasing. So you can see there's a lot less farms and a lot larger, more industrial ones. So the protectiveness of the farm environment is generally fading, which could potentially be why we're seeing more of an increase in these allergic conditions over time. Generally, your smaller farms are being bought out by these larger operations that can provide more food and don't have as many financial troubles. So certainly important to focus on policy in this area to try to preserve farmland and smaller farms where we can, and it could potentially impact allergic diseases and asthma in the future. Then looking at COPD, or chronic obstructive pulmonary disease. This is an urban versus rural prevalence here. You can see that COPD is generally substantially more prevalent in rural areas, with the poorer end or more impoverished rural areas getting close to 16% prevalence for COPD. while urban areas are only at about 9%. You can see that across the board, even the more well-off rural areas are still higher in prevalence in COPD. So obviously something going on there. And here's some factors that may contribute to that. You can see that generally rural areas are more likely, as well as areas which are more impoverished, ones which burn wood or coal as fuel, individuals in occupations where you may have more environmental exposure, such as agriculture, mining, construction, or manufacturing. Generally, your more blue-collar jobs that you see more of in rural areas. You can also see that it's more common in older individuals who have had a history of smoking, and it's most common in individuals who are white and a little bit less in individuals who are Black, but still very prevalent there as well. Additionally, it's more common in individuals with Medicaid and Medicare, those who are less educated and who are more impoverished, which kind of lines up with a lot of the general rural health disparities that we saw in the last presentation, where we have much higher rates of those in rural areas. So certainly a contributor to the increased amount of disease in those spaces as well. Additionally, access to care is a problem in these areas. About 30% of rural individuals have access to a pulmonology office within 10 miles, as compared to an urban area that has about 90%. Very substantial difference in access to care there, especially considering the virtual access that has been pushed a lot to try to help with that disparity. In my last presentation, I mentioned that about 50% of individuals in rural spaces don't have internet access. About a third of them don't have cell phone data, and about a quarter have no digital access whatsoever. So certainly something to focus on and improve there as well, which this study said is where Project Echo comes in. Educating primary care teams and individuals who are more likely to be able to manage those conditions in those areas, since they don't have access to pulmonology. The primary care provider is generally all that they have. So the more you guys can learn, the better you can manage those patients, and certainly something for us to work on pushing more research for as well. Then looking at vaccination, starting with influenza. This is the vaccination coverage in children from 6 months to 17 years, pre and post-COVID. You can see there's been a substantial decline in pretty much everywhere for flu vaccination, about 6% in urban populations, about 10% in suburban populations, and about 16% in rural populations. Obviously, there's some political factors at play here, but any education that can be done on this is substantially impactful. It may not be quite as important in rural areas for individuals who might not have as much exposure to others, but it's still important for children, as they're often going to school and still having other exposures like that. So certainly something to focus on. Additionally, this COVID-19 vaccination stratified by rural-urban continuum code. The higher the number, generally the more rural the area is. So you can see your urban area all the way on the left is about 62% versus about 40 to 42% on the right. So clearly a substantial difference in vaccination percentage between those communities. And then the average vaccination rate on the bottom, you can still see is about an 8 to 10% difference in those communities. So once again, obviously, vaccination education is a big thing that we should focus on within rural communities. Health literacy is generally a problem, as well as access to care. So it makes it hard to reach these patients a lot of the time. Looking at pneumococcal vaccination, I apologize that this figure is kind of hard to read, but the bottom left is where we're looking at rural versus urban. The urban and metropolitan populations, you can see, are the right two graphs at about 34 and 48% respectively, while as the rural population in the bottom left is about 23%. This is individuals who are aged 65 years or over and received the PCV13 vaccine. So you can see there's a substantial difference between your rural and urban areas once again. You can also see they were more likely to receive the vaccine if they were non-Hispanic white, more educated, and in a higher income bracket. So seeing a lot of those same contributors to health there as well. And then HPV, or human papillomavirus, you see about 10% lower across the board vaccination rate within rural areas. But in areas with rural counties that have primarily rural areas within them, the vaccination rate can get as low as 28.8%. Additionally, there were some studies looked at which saw that primary care providers within rural areas are generally much less comfortable talking about HPV and HIV than those you're going to see in urban areas. So certainly something to work on education for as well. Here are some policy opportunities to improve the HPV vaccination rates in those areas. There's a lot of these here, so we're not going to go through all of them, but these slides will be posted later if you're interested in looking at these. And then looking at chronic rhinosinusitis, or CRS, which is about 5 to 12% prevalent globally, with the US on the higher end, closer to about 12%. The rural versus urban prevalence in the United States is not well known. There haven't really been any studies that I was able to find that really looked at that. So obviously a place to look at for research in the future. And something important to note for my next presentation is that about 50% of those patients who have recalcitrant CRS develop a primary antibody deficiency or have a primary antibody deficiency, which is often a form of primary immune disorder. So certainly an area that we can look at to try and find some of those individuals. And then this was a study that, while it didn't directly look at urban versus rural patients, it did look at geographical factors that influence the prevalence of CRS. You can see that in the odds ratio in that third column, it is substantially higher based on the geographic and environmental factors alone in urban areas at about 25 times the odds versus the more farming or forest-centered areas. Unfortunately, there's probably not a ton of carryover as it's not directly looking at patients, but certainly something interesting and a reason to conduct some sort of patient study to actually see what the difference in rural and urban prevalence in these areas is. And this was a lot faster than last time because I didn't have quite as much to talk about. But that's all I've got for today. So if you have any questions, feel free to ask now or email me later. And that's all I got.
Thank you, Jacob. Does anyone have any questions for Jacob?
Great job, Jacob. I have a question relating to kind of disentangling access and culture, and as those two domains kind of relate to healthcare services, vaccination, and even uptake of healthcare services in rural spaces. In your research, did you learn anything or could you infer anything that suggested, the kind of, I don't know, the kind of just how important culture is and cultural practices in rural spaces are in terms of even if there was access to healthcare, how important is that from what you've read and what you've studied thus far?
Absolutely. That's probably one of the most important things as far as vaccination and education and health literacy go in those areas is that they really have to have a relationship with the individual that's talking with them about it. There's a lot of like lack of trust in those areas. There's a very like kind of cultural bias towards medical mistrust in general. One of the things in the studies that I looked at that really helps with that is community health workers. So individuals from the community who are kind of informed about that and can talk to them about that on a more personal level can really help to improve vaccination coverage and education in general in those areas. I know there's some issues with getting funding for those individuals as they're generally grant funded. So that's an important area that some of the rural health associations are pushing for policy in to try and improve access to those individuals because they really can be very helpful in improving those outcomes.
And the community health workers are individuals who typically live in the community, but also serve a role in both healthcare advocacy as well as delivery. Is that correct?
Yeah, that's correct.
Thanks so much. That's really helpful.
Does anybody have any more questions? Okay, well, we're going to start wrapping things up. I just put it in the chat. That is our YouTube channel. So after today, we will put this video on our YouTube channel for us to be able to come back and visit at any time if you have any questions. I also, we serve, IACO and our Peppy, we serve to just do more for our community and more for primary care doctors. So if you have anything that you want to learn about, if you have certain questions, if you have anything that's just on your heart that you want to just dive in more and ask us questions, please reach out to us. Our email is in the chat box. We also have a discussion board on our iEcho platform. So reach out to us because we're here to help and we want to help you in any way that we can. And that's pretty much it. And I want to just thank you guys so much for taking the time out of your busy day to come in and listening to Jacob.
Join us on October 8th for the third part in this great series.
Thanks,
Appreciate
Nick.
everyone's time. Thank you so much. Bye all.
Bye. Have a great day.